And the second phase of vaccination in our country will kick off from Monday. Of course, the first couple of days is going to be slow as people discover the process, as systems get put in place. But there's been a lot of hectic activity within the corridors of the central government, within various departments, conversations with the private hospitals who will be a key stakeholder in the next phase, conversations with obviously the vaccine makers. We still don't know what the pricing will be for vaccination. If you go to a private hospital, it will be free, of course. At the government hospitals, well, you will have to pay a charge if you go to a private hospital. Who's eligible? Well, we know everybody above the age of 60 is eligible. Those above the age of 45 with certain comorbidities will also be eligible. Now, here is what else we already know about this fact. And apart from the age and the comorbidity criteria, the fact that vaccination will be at about 10,000 government centers and 20,000 private hospitals. It will be free at the government hospitals. It will be chargeable at the private hospitals. We don't know what the charge will be. Now, interestingly, we don't know what the final list is going to be about the definition of comorbidities, because obviously people above the age of 45 will have to show documentation that this is the disease or this is the illness or the condition that they have, and which is why they are eligible for this vaccination. But experts tell us, many of those who are closely linked with the entire process and the planning, that heart disorders, uncontrolled diabetes, chronic pulmonary diseases, kidney ailments, cancer, morbid obesity could be some of those who make it to the final list. Now, how do you get vaccinated? That's the other interesting point. The government is going beyond the earlier announced mandate that it has to be with a pre-registration on COVID app. The government is now saying that either you pre-register on the COVID app or you can walk in at the vaccination center. Somebody can help you. They'll also send out groups of people on ground to help people, get them to common centers where this process can be done. You can also use the Arogya Setu app, we are told. All of this as a final set of guidelines will come from the government. But I've got a panel of experts, and if you've got some questions, then pick up the phone lines and dial our number and ask your questions. And me and our panelists together will try and address as many of your concerns as we can. Let me say good evening to Dr. N.K. Arora, Executive Director of INCLIN and the Chairman of the COVID-19 Working Group. Thank you so much for being back with us, Dr. Arora. Let's also say good evening to Dr. T.P. Lahane, Director of the Medical Education and Research in Maharashtra, Dr. Ashok Seth, Cardiologist and Chairman of the Fortis Escorts Heart Institute, and Dr. Sudarshan Balal, welcome back, Chairman of Manipal Hospitals and on the expert committee for the Karnataka Health Vision Group. So good to have all of you here. Dr. Arora, let's start off with what I find very interesting this time. Is the multiple options that are being given to people, and hopefully that will make it convenient for citizens who need to get vaccinated and also speed up the process. If you could take us through some of these options and details.
So, Tanvi, thank you very much for inviting me. And in fact, you have set the ball rolling very well and already informed who all will be now in line for getting the vaccine. And as we were discussing a day ago, that flexibility will be the hallmark, so that we are dealing with elderly people, and many of them may have other comorbidities. So flexibility is essential, and that's what has been taken into account. So either already whatever lists are available in the government, they will be uploaded, or whether like voter list or any of the other local list of people above 60 will be uploaded on the CoWIN, or you can upload your name yourself. But in case you are having difficulty, walk up to the nearest immunization center, register yourself, and most likely you will be able to get the vaccine right then and there, because at the moment there is not much crowd, and the things are within the kind of a capacity of each center. And once you will get registered, you will get a SMS immediately after getting the vaccine. congratulating you that you have received the first dose. And later on, 28 days later, you will get a reminder and then get the second dose of the vaccine at the same place. That you have to keep in mind, that the vaccine second dose will also be given, but it has to be on the same center, and you will be given the same vaccine, whatever vaccine has been given first time. And when you get SMS, you also get information about who has vaccinated you, the name of that person and the telephone number of that person, so that in case you have difficulty, call that person. And there is a toll-free number as well. So a lot of effort has been made to make life simpler. And also, when you reach the immunization center, it is a pleasure to see. I think many of us have never experienced that kind of smooth. You go, you get yourself registered, or your papers are screened, then you move on for the immunization. After immunization, you will be asked to wait. There is a waiting room. And after half an hour, you can leave the place. So every immunization center across the country has been set up in a standardized way so that there is minimal difficulty. And in case if there is a severe allergy or something, there are arrangements for immediate care as well as shifting to a designated hospital. For example, if you're in a distant rural area, let's say, so the person there who is managing the treatment, the immunization center, knows exactly where to transport you. So there is no contact time that where should I send this person.
Actually, that's a very interesting point that you've mentioned, and often people have this conversation or ask us this question, Dr. Lahane, because while what happens in the urban areas is still understandable, we can see how it's going to function, but rural areas, and especially when you talk about senior citizens or those who have serious comorbidities, could be a challenge. Now, how are states going to go about that?
In the rural areas, first of all, the comorbidities. When we were having the program of the this my family, my responsibility, we have served near about all the citizens of Maharashtra, and we have got the list of the comorbidities patients all over Maharashtra. So that is, I think, very easy for us to update their names on the COVID. Now, this time, this will be the COVID 2, not COVID 1. So now this will be COVID 2, and in that we can include the name. And also even the citizens, they can also download this, and they can also write their names in this app. So I think this is not difficult in the rural area also. Now today we are having there about 850 centers in the rural area where we are immunizing. And in the whenever now we are coming in the second this one, in that we are also registering the 900 odd private centers also. So I think it will be easy as we have got the registered their numbers, their mobile numbers and everything. So we'll be able to register them easily.
Oh, so that's very interesting. You're saying that the state has already prepared a list of the eligible beneficiaries for next round?
I have half heard your question.
You are saying that the state, like for example, Maharashtra has already got the list ready of the eligible beneficiaries for next round?
Yes, eligible, that is comorbid.
Yes,
comorbid.
yes.
Eligible beneficiaries, two types. One is above 60, that is everywhere in this one.
Correct.
But in Maharashtra, 45 to 60 years of these citizens, already we have got the list of the comorbidity in Maharashtra. And so that will be very easy to upload this list.
Okay, very interesting. Dr. Ashok said, good evening to you. How do you see, the private sector's role now in phase 2? There was quite a bit of a conversation and a demand that you need to bring in the private sector in a bigger way. Now, how does that work?
So let me just say that private sector is still a part of fighting the war against COVID shoulder to shoulder with the government. The war is not over. We're still admitting patients. We're still treating them. We're still a part of the vaccination drive, as per se, even in the first 6 weeks. And I think the augmentation and enhancement of vaccination drive became absolutely important. And I think the government has been very meticulous in the first 6 weeks of its preparations. I mean, I'm so impressed that this is actually what even the West can't achieve. That is the reason why we see absolutely immaculate. Each person gets a vaccination within 4 minutes. He's actually observed. And those rules and regulations and the processes set by the government have been followed by every private sector. So I think this is a natural progression of the partnership, the trust and confidence. And also, by the way, you've also noticed that the private sector has actually felt it as a responsibility, is proud of bearing this responsibility, and there's a nationalistic feeling about being a part of the fight against COVID, which also includes enhancement of the vaccination drive.
Yes, absolutely. Yes, go ahead, please.
We look, and the second aspect is that we look forward. I know the government has opened up. There are still lots of areas not defined accurately, which will happen over the next 24 to 48 hours. For example, we're still not certain about the cost of vaccination. But I must also enhance the fact that no center and no private healthcare is looking at a revenue-making model at all. We're looking at the fact that can we do service? Can we actually enhance this vaccination drive? Can we take the burden away from the government to say, we're also going to help in the logistics, we're going to help with the personnel, we're going to help with the vaccination, and can we vaccinate more of the people in this country so that we actually get over this COVID and everybody gets back to normal? That is the must for the country. That is the profit for the country. That's the profit for our population. And that's the bottom line for the country.
Well, if I can take it a step forward and also ask Dr. Bilal, good evening to you and thank you for joining us. We've had conversations about how, vaccination has taken place so far in phase 1. We've also spoken about, what's delayed the process or slowed down the process or the glitches or the hurdles that you may have faced in phase 1, which obviously form part of the learning lesson for the next round. Now, do you think it's a good idea what we're looking at then in that light, that we don't just depend on pre-registration on COVID and actually have other options available as well?
Good evening, Tanvi. Thank you for having me here, and good evening to my co-panelists. I think it's not good news, it's great news. I've always batted for private sector and the public sector working together, and the best example honestly happened during the COVID era, where both of us worked very hard and somewhat controlled COVID in our country much better than the rest of the world. Now, coming to the process of vaccination, we have already had a trial run because many of our hospitals have already vaccinated our healthcare workers in the first phase. And the process has been quite smooth. We have multiple booths. Each booth has about 3 persons, one for entry of data, one for the vaccination, one as a helper. And for every 5 booths, we have a doctor and a nurse for any emergencies with a resuscitation kit available. So we already have had a dry run. So it's not going to be very difficult for us to ramp up. And I think government in its wisdom has opened up the private sector, which was the need of the hour, because we need to accelerate vaccination, because we cannot afford to have a second and third wave of COVID, which will destroy our economy. The pricing is absolutely of no concern, as Dr. Seth mentioned. It's a very small price to pay for the safety of the nation and saving the nation from the disaster of corona. So we in the private sector are looking forward to getting this program going. And I think the government has already given us a fair amount of clarity. There will be still a few wrinkles to be ironed out. But if the process starts, I'm sure the wrinkles can be ironed out as it happens. And we do hope in the next 3 to 4 months, we'll cover the 30 crore people that the government intends to vaccinate.
Oh, yes, hopefully. And we'll also have a lot more vaccines in the market that will then help us speed up the process. Of course, the first few days is going to be slow. As we did see in the first round as well, but understandably so. Let me also tell our viewers the basic, what we've learned so far. Of course, our experts know this, but in terms of registration, and if you are trying to find more information, one option is self-registration that you can do by logging on to this COVID app. The app for you, if you are an eligible beneficiary in the next round, this app will also go live for you and be accessible to you from the 1st of March itself. So you register on that, or you can even register and get a date for yourself on the Arogya Setu app. If you already have that, you can even do that, and you just have to punch in your details, choose your date and time, and the COVID center which helps you and is closest perhaps, and that's that. And then you can turn up on that day for your vaccination shot. The other option is, and for several of the elderly who may not be extremely tech savvy, choose walk-in. On-site registration, a walk-in option that is being made available. Somebody there will help you register as long as you have all the details and the necessary documentation with you, and then you can get vaccinated. Obviously, a lot of this really depends on what is the availability of a slot and the crowd over there. The third is there will be groups who will try and facilitate this, including the state governments and the union territories. They will have to take the proactive lead, like Dr. T.P. Lahane was just telling us. They already have the list, so they know who's eligible above the age of 45 with comorbidities. They're going to reach out and help them plan it out so that they can turn up and get their shot. So there are these multiple ways that have been planned. We, of course, once it actually begins to play out, it will get clearer of how it's working on ground as well. But I just wanted to ask this.
Anyway.
Yes.
Tanvi, can I just come in just for 30 seconds to say that there are concerns about a non-equitable distribution of the vaccine, because on one hand, people are ready to pay for it, and then there's a whole lot of population who may not be able to pay for it. We must understand that here the government is the gatekeeper, even for the vaccine distribution. We are following the rules and regulations laid down by the government to fight the war against COVID, as we've done for the past whole year, and that's what the private sector has done. So I don't think people should be concerned. In fact, you call this a debate. I think we are in agreement that even those ideas need to be put forward, and the government needs to incorporate those ideas to say, how do we actually have an equitable distribution of the vaccine? And therefore, the private sector is not here to just do one side of it. We all are working together in this whole arena.
Okay, let me in fact get Dr. Arora also on this. Dr. Arora, how do we ensure there is equitable distribution?
See, that is fundamental to the whole exercise. So government announced that there will be approximately 20,000 immunization centers in private sector and currently around 10,000 in government sector. But the government has the capacity to expand the government-centered immunization centers to between 50,000 to 100,000. And in the next phase, and as we know, the private sector is mostly in urban areas. And it is important that in urban, the transmission of the virus is much more. And the urban, rural areas, there will be exponential increase in the immunization centers once these private sector urban areas stabilize and the other 10,000 are working. So we should never be worried about equity is at the heart of the whole public health system in this country. We will be there at the remotest corner of Arunachal Pradesh. We will be there in Meghalaya. We will be there in Chhattisgarh. We will be there in those areas which are one has to walk up to those areas, but immunization centers will be there in all these places. The second thing is, as I understand, even in private sector, those with BPL cards or some of that poor urban urban people probably will be walking up, and the government will pay for their immunization if they go to a private sector. So that arrangement is also made. So it is not that that issue is not at the back of everybody's mind. It is at the heart of everybody's mind.
Is there some kind of a categorization for who gets it free or who has to pay for it, Dr. Arora, or anybody who turns up at a government hospital can get it free?
Anybody who turns up at government sector immunization center will get it free without no questions asked.
Okay.
But in private sector, there is a very serious discussion going on that those with BPL cards or very poor people, they will, when they come up to private sector, private immunization center, on the basis of that, somebody else, the government will reimburse their cost. They won't have to pay.
Okay, interesting. And I imagine because we are also headed into election season, there may be some state governments who want to do this. I don't know if their code of conduct will allow them to do that anymore, to announce that the vaccines are going to be free or we will pay for you. But we'll wait and watch how the politics of it plays out. Let me go across to some of our viewers. We have such esteemed panelists. Let's get some queries going now. Gaurav is on the phone line and he's calling us from Gurugram. Good evening, Gaurav. Go ahead, please.
Good evening. Thank you for taking my question. So I have two questions which are related, and it's regarding the elderly. It's concerning my mother who's over 90. First, is the vaccination safe for her? And second, she cannot travel to a vaccination center. So can the vaccination be given to her at home? Because that's a real concern for us.
Okay, thank you so much for calling. I think the first one, the answer is clear that if you go to a government hospital, it's free. If you go to a private hospital, you may have to pay for it. But what about the fact that for those beneficiaries who may not be able to travel, Dr. Lane, what happens in that scenario?
So those who are not able to travel, now we have got the ambulances in Maharashtra, it is 108. So those names are there, and if the SMS is there, somebody contacts us, we will send the ambulance and we will bring them to the hospital. But it will be not possible to give them at their house, because we will have to see post-operatively. There should be a doctor to observe, and because of that, it is not possible the home vaccination. So we can bring them, and the facility is already made in the Maharashtra.
Okay, so because you have to be under observation after you get the vaccination shot, that will not be possible if somebody comes to your place. Dr. Seth, you wanted to add to it?
Yes, he also mentioned that his mother's 90, and his concern we haven't addressed. It was related to the age, that whether she can actually have that vaccine. And I must assure you that people above the age of 90 can have the vaccine. In fact, my father is a doctor who's 97, and he's perhaps the oldest person till now who's had the vaccine, because he's a doctor and a practicing doctor. He's had his first dose, he's been fine, and is soon going to have his second dose. So I think you should allay this fact about age. Everyone should be able to get the vaccine. It is safe.
All right, great. Thank you so much for allaying that fear as well. And I think that actually is one of the biggest concerns that many people have. Age may be a factor for many. For others, it may not even be a factor, but general concerns. But it's always good to keep emphasizing on this again. Percy is on the phone line calling us from Mumbai. Good evening. Go ahead, please.
Good evening to all the panelists and to the anchor too. I have a simple question. It's regarding the vaccination for people who have got the G6PD deficiency. Are they allowed to take the vaccines or not? Do they come under that category to get the vaccines? And if so, which vaccine would be suitable for that this criteria of people? Because a lot of Parsis and Sindhis do have this deficiency, G6PD.
Yeah.
Thank you for calling, Percy. Dr. Arora, would you like to take this one?
Yeah, G6PD is a congenital enzyme deficiency. It is not a life-threatening issue, and these people have to be brought up, and they live with a care, and they avoid certain drugs. So in this round, they are not part of the morbidity list. However, when the vaccination is open for everybody, then all these people should also get the vaccine. And any vaccine can be given. I must tell you, at the moment, globally and in India, whatever vaccines are available and also those in pipeline, they're all safe vaccines. So there is no issue of pick and choose between the vaccines.
Okay, so you can take the vaccine whenever you are eligible for it in this round, or if you're above the age of 60 and you have this condition, it's not a problem. You can go ahead and take the vaccine, or whenever your turn comes. Dr. Balal, did you want to add to it?
Yeah, I was just going to add that this is one of the safest vaccines we have had. It's just like a flu shot or any other shot. There are very few contraindications, including age. And by and large, people should not be fearful of the vaccine. The fear of developing COVID should be far more than the fear of any problems related to the vaccine. So if there's any doubt, please check with your doctor before you get vaccinated. But by and large, it's a very safe vaccine, and both the vaccines that are available in the country have similar effects, and there's nothing to choose from as of now.
Okay, let's move on to the next one then. Varun Jain is on the phone line calling us from Delhi. Good evening, Varun.
Good evening. Thank you for having me. I actually wanted to know first that since the privatized paid option of vaccination is going to be available from 1st of March, shouldn't it be available for everyone, since there is a lot of apprehension and not many people are turning out for vaccination as per the past data available to us? And secondly, is that with the advent of these new variants that we have, the ones which have newly come up in Maharashtra, along with the Brazilian, the South African, and the English variant, isn't there some kind of data available to us so that we know that in future, if the current vaccination doesn't work, what are the other options we should be using?
Okay. Well, my sense would be that while we do have a lot of stock, it's still you have to prioritize who gets it first, which is why this list has been made. It's a norm that's being followed across the country. Well, roughly about 12 crore people get eligible under this phase 2. And even if you say that, say, 1/4 of them turn up in the initial few weeks, that's still a significant amount of people and 2 doses for them. So you're still looking at keeping about 4 to 6 crores of doses ready for this round before you open it up to next. But to the second aspect, Dr. Seth, would you like to take up this question? Yes.
Tanvi, if I can come in for answering our friend, and that is India has a target of immunizing 30 crores in the first phase. And the program has made arrangement for 650 million doses at the rate of 2 doses per person. And about 10% wastage has also been taken into account. And this will be available till July, August. And thereafter, so this phase of prioritization, at the moment we have opened up till 60, but it will get opened up for everybody above 50 in the next phase. And so in a gradual way. But those who are young, we must understand why prioritization has been done. Those who are above 50 or 60, the risk of mortality is 20 times higher as compared to the rest of the age, as per Indian data. This is our Indian own surveillance data. And therefore, we want to reduce this morbidity and mortality and prevent the disease, first of all, among them, and then go over to the next. I can assure you there is plenty of vaccine in the second half, and it will be available for everybody, not only in India, but several other countries also. So we need to be a little patient for that. Yeah.
I would also add to Dr. Arora that it's not just 2 vaccines that we have at the moment, but 3 to 6 months later, there would be at least 5 vaccines available to us. We must remember that India is the biggest vaccine producing hub of the world. And therefore, I don't think anybody needs to be worried or scared. Dr. Arora is right. Elderlies and prioritization is across the world based on who has got the largest chance of having serious disease and dying from the disease, and that's what the prioritization is all about.
So there is Sputnik, which is I believe right now the closest to get approval in our country. There is also Zydus Cadilla's contender, which would be the third one, Dr. Seth, that you are watching out for.
So there's a nasal vaccine which we hope for, and the Pfizer perhaps will start doing its trials in the country soon.
Yeah.
So that we could actually have that in a horizon in perhaps 6 months' time.
So yes, so in a few months you will have a lot more vaccine brands available, and so thereby a lot more doses, and then we will obviously be opening it up to a lot more people. Let me go across.
A better RNA vaccine is going to come in India, better than Pfizer, better than Moderna, and it will take care of the variants also. So just wait for a while, and that would also be there by June or July. A Indian mRNA vaccine.
And Tanvi, the variant is a very important issue.
Yeah.
We should not just brush that aside. The more that the virus goes on, the longer it goes on, the more it changes itself. But one of the important aspects is that while we still don't understand enough, I think I just want to allay the fears of the person who asked the question. Perhaps the present vaccines do work against it, but actually this is being tested. And soon we could actually, within 4 to 6 weeks, have a vaccine against the variant. So I think we just have to keep a good watch for it. And perhaps more and more people need to get vaccinated to avoid this variant and mutants.
Yes, so one has to keep in mind that as we move on, the virus itself is also evolving, and it's obviously evolving to survive. So it's adapting to the conditions that it sees. In some cases, experts say that that could also mean that it spreads faster, but we are yet to find too many variants which are deadlier than what we have seen, at least in our country. So let's hope that we get more and more vaccines in the market before the cases go up. Mr. Maini is on the phone line calling us from Chandigarh. Good evening. Mr. Maini, can you hear me?
Yes, I can now.
Good evening. Go ahead, please.
Good evening to you, ma'am, and good evening to the panel. My doubt is, yes, I can. Good evening to you. My basic question is, I'm suffering from diabetes for the last 10, 12 years, and I am on blood thinners. I'm 73.
Mr. Maini, you just have to go on talking. We can hear you. You are hearing yourself in the television set with a lag. So I would suggest that you just mute the TV set.
Okay. My wife is also. Yeah, I got that. My wife is 70. I'm 73, and I'm a diabetic patient on blood thinners. My wife is hypertension patient. She's on medication. And do we need to take this vaccine? Because I've been given to understand by a friend of mine who went to Fortis today to say that he, being a heart patient, he need not go for the vaccine. Thank you very much.
Actually, you've raised two very interesting, from your questions, two larger themes have also come. So I hope our panelists will be able to address both your questions as well as the larger issue. The first one being about diabetes. And I understand, Dr. Lane, that the list says those who have, there is a differentiation being made on controlled diabetes and uncontrolled diabetes. So what does that mean, and how will a beneficiary know?
What the question asked was very correct, that from 10 years he has got the diabetes. Also, he is on the blood thinner. And as the diabetes is there, can he go for the vaccine? Yes, he can go for the vaccine. Now the question remains about the diabetic control. I think whenever anything you are taking, that may be any injection or anything, your diabetes should be under control. And if that is under control, that helps you that healing. So I think he should control his diabetes and he can go for the vaccine. Secondly, about the wife, that she has an hypertension. I think in the hypertension also it is not contraindicated, and these are both are comorbid conditions. And what we are aiming is to vaccinate these comorbid conditions, because here the chances of you can say the severity of the disease is 20% more than any other patient. And so I think both conditions, I think those are more indicated for the vaccine.
Okay. Dr. Seth, go ahead, please.
That's right. Firstly, of course, we have to allay their anxieties, and clearly diabetes, hypertension, heart disease are actually indications for you to go for the vaccination. And I think you misunderstood the fact that your patient went to Fortis and because you have a heart condition, you shouldn't have the vaccine. In fact, it becomes the most important thing. The second aspect is blood thinners, and I need to allay that very importantly. There are two forms of blood thinners, and that's what's worried the public when it came on that blood thinners is a contraindication to vaccination. There's the aspirin and clopidogrel, which are tablets which are weak blood thinners, which is put in the same context as a blood thinner. And then there is anticoagulants, which is like warfarin, which is like acetylene, which is like drugs like Eliquis. Those are powerful blood thinners. Aspirin or clopidogrel is not a contraindication. In fact, no blood thinner is a contraindication. If you're on aspirin, and I was on aspirin and I took the vaccine, no problem, a bit of bruising. So you don't have to stop aspirin or clopidogrel for vaccination, and you can take the vaccination. If you're on a powerful blood thinner, for example, for atrial fibrillation or a clot or a lung clot, that you actually take warfarin or acetylene, then speak to your doctor, because there are ways still to take the vaccine. You just have to be a bit careful, maybe stop the medicine a day or two before, take the vaccine, just press on the pressure point for a longer period of time, and you're fine. So nothing is a contraindication. Aspirin is not a contraindication, requires no stoppage of drug. Warfarin and acetylcholine and others may require stoppage of the drug for a day under supervision of your doctor, but have the vaccination. Vaccination is a life savior, not for yourself, but for the whole country and for others as well.
Thank you for explaining that, because I think that's really going to be helpful to a lot of viewers here who have these similar queries, especially if you are on blood thinners and have a cardiovascular condition. But if I can just pick up on the diabetes question as well and just get one more clarification, Dr. Balal, because we are saying that it is you are eligible if you have uncontrolled diabetes. What about those who are taking medicines or injections and usually it's under control for them? Then are they eligible?
See, now this is something that needs clarification, Tanvi, because there are clinical parameters for what is uncontrolled diabetes. But for the purpose of vaccination, whether it is possible to check everyone, whether they're controlled or uncontrolled, is difficult. We go by two parameters essentially. The most important parameter is the 3-month average of your blood sugar by a parameter called hemoglobin A1C. About hemoglobin of A1C of 7 is good control, and the higher it goes, worse the control. Lower it goes, then the lower the blood sugar and risk of low blood sugars. So, but for the purpose of vaccination, I'm not sure everyone can bring in a report of the hemoglobin A1C to the vaccinating center. We will either have to go by what the patient says or what the patient's doctor says. And also there are parameters of your blood sugars in the fasting and postprandial state, which we can use for how well your sugars are controlled. But this is something that may be difficult to check on everyone who's coming to the center. So we have to take it at face value or a prescription from the doctor saying he has uncontrolled diabetes.
Okay, thank you. Thank you for clarifying on that. I also had another query that many people have written to us and asked about. Dr. Lane, maybe you can take this one. In terms of those with comorbidities who haven't registered and who are going to do a walk-in, because you already have a list, you said, and you may help them also pre-register earlier. Will they have to come in still with additional documents to prove their condition, or is just an identification going to be enough?
See, what is requires for the COVID app is documentation. And though they are now the comorbidity, we know that we have registered their name. But after that also they will require a certificate from the doctor that saying thereby they have got such type of comorbidity, and there are 20 comorbidities identified in the COVID app for the we can say the vaccination from 45 to 60 years of age. So they will have to bring the certificate or submit the certificate online. That is, I think, is required essentially.
Okay, so you will have to get your certificate, you will have to, get some documentation from your doctor perhaps that this is the condition that you have, which is why you're eligible for the vaccination. As you've heard from most of our experts that for most of the conditions, whether it's heart-related condition or even cancer, you are eligible to get this and you can. But are there certain diseases or conditions, Dr. Arora, where you would advise people to first consult their doctor and see if the vaccine is okay for them to take? Dr. Arora, I think you're on mute.
Myself. So for practical purposes, I think Ashok Seth has said it very nicely, that practically there are no contraindications for most of the heart conditions. However, if somebody is, for example, admitted in a hospital for heart failure, or is in ICU, or is in left ventricular failure, at that time you would not like to give the vaccine. But otherwise, as very rightly said, age and any comorbidity, actually these are the conditions which are likely to be most beneficial, and therefore go ahead and get your vaccine.
What about somebody who's undergoing cancer treatment, immunotherapy or radiation?
Yeah, that's a very important immunotherapy or some steroids, autoimmune disorders, somebody, and they are getting on immunosuppressive therapy. They should all get the vaccine. There is no problem. Again, unless somebody is sick and requires hospitalization, if somebody is hospitalized, not to be immunized. But all these drugs which are given, in fact, it is said, and later on it will be decided if they need a booster. All those who are in immunosuppression, the immune response may be suboptimal initially. So they actually need an additional dose, some of them. But at the moment, we don't have evidence. So at least they should get their regular vaccine doses.
Tanvi, here I want to come in because I am a kidney transplant patient on the immunosuppression from 26 years. I took the vaccine and now I am going to monitor the antibodies so that I will come to know that I will require the booster or not. But yes, if you are on immunosuppressions or any, I have got 3 immunosuppressant drugs for kidney transplant, and I think that is indicated and you should go ahead for that.
Okay, but something that will require monitoring after the vaccine shot and, doctor consultation for the others. Dr. Seth, sorry, you wanted to add?
Yes, that's right. I did want to add that the one contraindication which people should keep to mind is a previous vaccine allergy or anaphylaxis. And that is the reason why we actually have that 30-minute period. It's not for little feeling dizzy or sort of nausea or something. And that's rare, but that's a 1 in a 10,000 or 1 in a 50,000 is an anaphylaxis reaction which leads to shock. And people who've had previous anaphylaxis need to consult the doctor. We need to be cautious about it. And that is the most important thing that we need to watch out for. So that history is important. It's always taken before vaccination. One contraindication which still exists.
Okay, thank you. Yes, Dr. Bilal.
Yeah, I just wanted to point out that we have a patient with a kidney transplant and a kidney specialist in the panel. So I think he's brought up a very important point. I think we have a large number of patients either who have kidney transplants or who are on dialysis. And these are the people who are at extremely high risk. We urge them to get the vaccination done. And please do not think of it as a contraindication. In fact, it's a special indication to get vaccinated. And very, very few contraindications, as Dr. Seth mentioned, anaphylaxis to a previous vaccination, and sometimes a serious neurological disorder that has been associated with the previous vaccination, like what we call as Guillain-Barré syndrome or paralysis. If those are there, you should consult your doctor and then take a call whether you need to be vaccinated or not.
Okay, so there shouldn't be any concerns about taking the vaccine for most of it, but consult your doctor if you have any other specific concerns, and that will help resolve the problem. Very quickly, I am a little short on time.
But I may just add one thing, and that's for the public. In fact, I get 50 queries every day, exactly from the people who should actually have it. To say, should I have it? These are the ones who got diabetes. These are the ones who got renal failure. These are the ones who got heart disease. These are the ones who got bad lungs. And they keep, and age, and they keep saying, I have this. Really, should I really get the vaccine? Is it dangerous for me? And I keep saying, this is exactly the safest thing for you to have. You're the one who should have it first rather than anyone else.
In fact, that's why they're on the priority list, and that's why phase 2 is actually all about them, so that we can help protect their health before anybody else. Ajit Nagendra Rao is on the phone line calling us from Mumbai. Good evening. Go ahead, please.
Yes, I just wanted to ask you a very simple question. Like, every country has like a vaccine policy, just like India does. But every country has a door-to-door vaccine policy as well as an e-card. They also tell you like how they're going to dose you. It's called mass education. But in this country, for some reason, just doesn't do that. So I'm just wondering, is this like you have some like specific plan to do this, or is it that you're just going some different opinionated way? Because every other country like China, Russia, Bangladesh, Sri Lanka, neighboring countries all the way up to America have an e-card. They have your name, they have your age, they have your dose date, they tell you what your update is. They have a correspondence system. This was done last year. So in India, it's nowhere. I mean, all they talk about is the vaccine, maybe a potential prize.
Well, Mr. Rao, I'm really disappointed that you say that information is not being given out. That's exactly what we did here tonight, and we've done a series of these shows. I would urge you to watch a lot of these. A lot of your queries will get resolved. Instead of e-card is what some countries may be calling it. We call it the COVID app, We also have the Arogya Setu app. All of these are centralized mechanisms for the central government to track. We have a representative even from the state right now telling us that they already have the list and they're going to be tracking it as well. But maybe Dr. Arora, you could shed some more light.
Yes. Sir, it is a dream come true. This COVID has come like a blessing. Now in fact, if I had known, I should have come with my COVID certificate. I have got both the doses and I have downloaded my COVID vaccination certificate, which is both in electronic form as well as hard copy I have downloaded. So this current platform is actually a major health system strengthening. You are registered, you know when you get the first dose, you get the second dose, there is a reminder, you get the second dose, and you get a certificate also. And the same thing now will be used for other programs. And I can tell you, so tomorrow your child, whether child is getting the first dose of the DPT or second dose or the measles vaccine, they will have all this certificate. Similarly, a TB patient will know exactly when the next dose of medicine is due for them to pick up from the clinic, they will go and do it. So I think we are entering into a very interesting digital health era where this kind of a platform will have a wide ranging use. And therefore, I think we have done better, much better than what you are thinking.
And in fact,
and Dr. Arora, you also give out a QR digital code,
yes,
which is absolutely easy for anybody to scan and know your history, and you yourself to know your history.
Yes, and in fact, a lot of this maybe we will be able to realize when it goes into the next phase and then the phase after that, because right now it's been largely about the healthcare workers who already know the system because they are in the system, and it's been about the frontline workers who've also been, specifically briefed about it. So a lot of the other people are a little in the dark. For example, I don't know what a COVID experience is going to be like because it's not accessible to us. But once I am eligible, or it is for people around me, we will obviously be looking at that. That's not to say the system doesn't exist. It's to say perhaps we are yet to experience it in the coming weeks. But thank you so much to all four of you gentlemen for joining us and taking all of our questions and queries and sharing insights. We hope to do a lot more of these conversations, in fact, in the coming few weeks, because it's Friday night. On Monday, the phase 2 officially begins, and all of these states will then begin to roll it out for the next set of people. The intention was 3 crore healthcare and frontline workers in phase 1. That's continuing now, and 27 crore in the others in phase 2. And we're hoping to together vaccinate about these 30 crore people by June or July. Hopefully by then there will be more vaccines in the market, and then it can be opened up to other people later this year. We'll keep getting you more and more details. Remember, there is still one very interesting part which is yet to be finalized and announced by the government, which is the pricing of the vaccination if you are going to go to a private hospital. Hopefully that will also come over the weekend. Thank you so much for joining us on this conversation.